Good evening, everyone. Hello, bonjour, quoi. We're going to get started. Thank you for being here. I would like to begin by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who live and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. This land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous people. Can we get the roll call, please, Madam Secretary?
Member G4, Member Bauer, Member Carr.
Present.
Member Chung,
Present.
Member Dudas,
Present.
Member Gower,
Here.
Member Kavanaugh,
Present.
Member King,
Here.
Vice Chair DiGiovanni,
Present.
Chair Kitts.
Here. Thank you. Regrets from Member Bauer? Do we have any declarations of interest? Seeing none. Confirmation of minutes of the meeting of September 16th, 2024. Are these confirmed?
Correct.
Thank you. There's one communication item that has been received and held on file with the Board of Health Secretary. Motion to introduce reports. Member Kavanaugh, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled 2024 Nutritious Food Basket and Food Security, Climate Change and Health Vulnerability Assessments, Risk Management at Ottawa Public Health, Attendance at the Association of the Local Public Health Agencies, ALPHA, Fall Symposium, Delegation of Authority, contracts awarded for the period of January 1st to June 30th, 2024, be received and considered. And be it further resolved that the rules of procedure be suspended to receive and table the report titled 2025 Draft Operating Budget for the Ottawa Board of Health.
Is this carried? Thank you, everyone. We will now go through the consent agenda. So item 7.1, Chair of the Board of Health verbal report, we will hold. Item 7.2, Medical Officer of Health verbal report will be held. 7.3, 2024 Nutritious Food Basket and Food Insecurity, we are going to hold for a staff presentation and delegations. Item 7.4, Climate Change and Health Vulnerability Assessments, we're going to hold that for a staff presentation as well. Item 7.5, Risk Management at Ottawa Public Health. Is this item received? Hold. Sure. Did you want to do it now or come back to it? Okay. Item 7.6, attendance of the Association of Local Public Health Agencies Fall Symposium. Is this carried?
Carried.
Thank you. Item 7.7, delegation of authority, contracts awarded for the period of January 1st to June 30th, 2024. Is this received?
Received.
Great, thank you. And item 7.8, 2025 draft operating budget for the Ottawa Board of Health. We will hold that for a staff presentation. So we'll go back to the first held item, which is my verbal report. On October 18th, Algonquin College, in collaboration with OPH, hosted the Future of Health and Wellness Series panel discussion that examined the connection between health and housing. Claude Brulé moderated the panel that included Kelly Tonner, Executive Director of the Southeast Ottawa Community Health Centre, Mark McCauley, President and CEO of Ottawa Salus, and Tim Aubrey, Professor of Psychology in the Faculty of Social Sciences at the University of Ottawa and co-chair of the Canadian Housing First Network Community of Interest. Claire Ferrer, General Manager of the City of Ottawa's Community and Social Services, department also provided opening remarks. The discussion highlighted the importance of pairing health and housing to end the cycle of chronic homelessness that many people find themselves in. Ottawa, like many cities across the country, is facing interconnected housing, drug toxicity, and mental health crises that has led to more people living without access to stable housing and without access to stable health care. We heard from our speakers that people from all walks of life experience trauma living in constant crisis, and that access to integrated healthcare is one of the most significant factors for transitioning people out of chronic homelessness. La solution n'est pas simple, mais elle implique une approche intégrée de soins communautaires et un esprit de pollinisation croisé entre les secteurs. SPO continue de travailler avec des partenaires pour identifier et discuter des besoins en matière de santé et de logement des résidents d'Ottawa confrontés à un logement instable et ayant besoin d'accès aux soins de santé. OPH is also seeking to collaboratively identify opportunities to improve current care models, system integration, and enhance connections across the health and housing sectors to prioritize areas for action. As chair of OPH, I continue to advocate for funding for our Healthy at Home proposal, which Dr. Etches will speak to later. This past weekend, I, along with many of my council colleagues, attended the city's Rural Summit. This was the first summit of its kind in 17 years, highlighting Ottawa's unique rural character and contributions, as well as the need for tailored solutions to address rural challenges. During the summit, the mayor announced several key commitments that the city will pursue in the coming years. Of particular interest to this board, I had the opportunity to share Ottawa Public Health's commitment to developing a rural resident wellness toolkit in 2025. This toolkit will centralize rural-specific mental health resources and include an online rural wellness resource page, which will help rural residents, particularly youth, find and access support both online and within their communities. While these resources are being developed, Agriculture Wellness Ontario resources will be added to the existing OPH Business Support Toolkit to support agricultural workers in the interim. Je tiens à remercier tous les habitants des zones rurales qui ont participé au sommet, dont beaucoup sont des agriculteurs et des travailleurs agricoles qui ont pris le temps pendant l'une des périodes les plus chargées de l'année, la saison des récoltes, de discuter de ces résultats importants lors du sommet. In tonight's meeting, we will be tabling our budget for 2025. This is a budget that is guided by our strategic plan, our requirements under the Ontario Public Health Standards, the public health needs of Ottawa residents, and City Council's term priorities. Le budget consiste à établir les priorités, à prendre des décisions et à être financièrement responsable en tant que fonctionnaire. This is particularly important at a time where we hear from residents about their own financial struggles, and we will hear later this evening about the challenges that some families face with food security due to the rising cost of nutritious foods. I believe the budget you will be receiving tonight reflects sound fiscal management and continues to deliver on what Ottawa residents expect from us. This year is seen as a transition year for the OPH budget. As we know, the Ontario Minister of Health is reviewing the funding formula for Ontario public health units, and we anticipate hearing more about the results of that review in 2025. As we reflect on this year's budget, we must acknowledge the work to find efficiencies, but also to recognize there continues to be significant population growth pressures on OPH. I'm looking forward to the discussions we will be having on this budget for the days and weeks to come, and I would like to extend a special thank you to Kibria and his team on the great work they've done on this budget. This concludes my verbal report. I'd be happy to take any questions. Seeing none, can we receive the report?
Received.
Great, thank you, everyone. Item 7.2, Medical Officer of Health Verbal Report. Over to you, Dr. Etches.
Right, good afternoon, or not quite into the evening yet. Bonjour, Kwe. I also just wanted to recognize the passing of just a champion for reconciliation and someone who's really shown really all of Canada how we need to go forward and improve health and well-being of Indigenous peoples in Canada. And I think many of the actions of this board have been based on the Truth and Reconciliation Commission's work that was led by Marie Sinclair, and I just wanted to recognize that. Otherwise, tonight I'm going to talk about the fall respiratory illnesses and protecting against them, homelessness, addictions, and recovery treatment hubs, a little more on the health and housing subject, as well as our staffing announcement to end. So the levels of COVID-19 circulating in our community remain high, and we're seeing an increase in both RSV and influenza. This is typical for the start of the respiratory season. And we expect that this virus activity will continue through November and December. Illness due to respiratory viruses definitely has a significant impact on our lives, on our plans for work and play. And so I do want to encourage everyone to contribute to maintaining your social connections, your physical activity throughout this respiratory season. These activities are important to our overall health, including our mental health. And vaccinations can help us stay well to pursue these connections that we need. Je veux encourager tout le monde à continuer à maintenir les liens sociaux et à faire de l'activité physique tout au long de la saison. Ces activités sont importantes pour notre santé globale, y compris notre santé mentale. Les vaccinations peuvent nous aider à rester en bonne santé pour garder les liens dont nous avons besoin. So I encourage everyone to receive the updated COVID-19 vaccine and their annual influenza vaccine. This year's COVID-19 vaccine, it's the KP2 variant, and influenza vaccine that's updated for this season. That campaign for both of them began at the end of September. It started with populations in hospitals and long-term care homes, vaccination for people at higher risk of severe illness and priority populations. That continued throughout October at local pharmacies, community health providers, and Ottawa Public Health's community clinic, and our neighborhood health and wellness hubs. And it's just as of October 28th that eligibility for both COVID-19 and influenza vaccines is open to everyone 6 months of age and older. And pharmacies are now the main provider of these vaccines. As well, many primary care providers are providing influenza. They receive their supply directly from the Ministry of Health in the case of pharmacies, and we distribute to primary care providers. Vaccines are widely available in the community, and so our clinics with Ottawa Public Health are really focused on supporting populations who have barriers to vaccine. Sometimes this is families with young children under 5 years of age, newcomers who may not have other access. And so I do encourage people to check their pharmacy near them. There are sometimes walk-in available options. Many times I've checked myself, been vaccinated recently. There are same-day appointments. And to protect ourselves and others, of course, we can't forget about the layers of protection. So staying home when we're sick, wearing a well-fitted mask, frequent hand washing, these are also helpful to limit the spread of infectious diseases that are respiratory viruses. Et pour nous protéger et protéger les autres, nous ne pouvons pas des couches de protection, comme rester à la maison quand nous sommes malades, porter un masque bien ajusté et se laver souvent les mains. Ceci est essentiel pour limiter la propagation des virus respiratoires. Similar to previous years, we do anticipate that there'll be an increase in respiratory virus outbreaks during this season. In the case of outbreaks, our teams are supporting facilities with older adults and people living in congregate settings by providing guidance on infection prevention and control measures. We support outbreak management, and we'll continue to work closely with a regional IPAC, we say IPAC for Infection Prevention and Control Hub, and the Champlain Acute Care Partners as they help with knowledge dissemination and collaborate on best practices, whether it's addressing staffing changes or adapting to changing guidance. The other virus, the RSV, respiratory syncytial virus, so there's good news this year that infants and children, older adults, people with weakened immune systems and complex health conditions, while they're at higher risk for respiratory syncytial virus, they also are eligible for RSV vaccine. And this vaccine, I want to comment on it for infants. High-risk infants have received RSV protection for nearly 20 years, but the Ministry of Health is expanding its eligibility to RSV and its RSV prevention program, meaning more infants can receive this protection. Anyone born in 2024 and throughout this season. So Ottawa Public Health is working to promote the uptake of this vaccine, which can prevent hospitalization. We are redirecting some of our vaccine capacity. Nurses are helping to support healthcare providers to share this information and to vaccinate people who are eligible. The birthing hospitals and CHIO have the monoclonal antibody that will used for immunizing newborns and infants and high-risk children at their sites. Eligible infants and high-risk children who don't receive their RSV immunization at birth can access it through their regular healthcare provider. And Ottawa Public Health is also offering RSV immunization appointments for infants who don't have a regular healthcare provider at our community clinics and through a weekly clinic at the Ottawa Birth and Wellness Centre. We've been actively distributing the vaccines for the older adults since August, starting with long-term care homes, retirement homes, and hospitals, Wabano Centre for Aboriginal Health and a Kausavik Inuit Family Health Team, and Ottawa Inner City Health. And we have now partnered so that there are Indigenous specific clinics offered with Wabano. Some retirement homes continue to have limited capacity to vaccinate their residents. And so with provincial funding expected specifically for RSV, we are extending our work, and our public health nurses are currently working in 23 retirement homes, or so far they're going through them to continue to make sure that protection is extended. So I encourage all residents who may be eligible for these vaccines to learn more, and those who are interested in the respiratory season and the status. We still have, I'll recommend to you our respiratory surveillance dashboard. It still uses wastewater testing and hospitalization information to describe the current state of the season, and it's on our website, ottawapublichealth.ca/respivirus. So for heart hubs, the health and addictions recovery treatment hubs, it is the case that work in this area fits with our goals, your goals as a board, to create conditions to live well and thrive and promote well-being and reduce harms. This is work that fits in the category of collaboration with our healthcare and housing partners. And since our last meeting, our teams contributed to informing the applications that our partners are making, including supporting transition plans for the Somerset West Community Health Centre consumption and treatment site. Les candidatures au hub soumises par nos partenaires visent à mettre en relation les jeunes de notre communauté avec les soutiens adaptés au traumatisme et plus accessibles, tout en connectant les personnes directement à des logements avec services de soutien et des services de santé dans la communauté. So certainly Ottawa, thinking of the rural summit that was just held and how big we are geographically as a population of over 1 million people and growing, we did make the case that the local health data demonstrates we need these heart hubs and increased services like them to support the people of Ottawa with wraparound intensive mental health and substance use care, along with services that focus on housing stabilization. And to mention what the chair had said about the Healthy at Home work, this was a project developed with a similar group of partners to look at how we could have a mobile service that would support people to stay housed by providing access to integrated team, both housing and health workers. And to further advance solutions related to the intersection of health services and housing, Ottawa Public Health and the city's Community and Social Services Department will be co-hosting a Health and Housing Leaders Forum in early December. This forum will bring together Ottawa leaders in health and housing sectors to develop a common vision of our needs and the current care models for people with mental health and addictions who are housing insecure or living in supportive and community housing. And in this forum, leaders will be encouraged and supported to prioritize areas for action so we can speak with one voice to inform the work that is ongoing with the province to bring more resources to Ottawa to help with meeting these needs. Since the provincial announcement of the consumption and treatment site closures in August, we are also continuing to collaborate with these partners and others under Ottawa's overdose prevention and response strategy, as well as hearing from residents and businesses in the communities most affected to identify the gaps that could be anticipated and potential solutions to mitigate the impact of the closure. Certainly, research demonstrates that we need to continue with providing prevention, early intervention, access to treatment and services, including a harm reduction approach, as well as collecting the data to understand the needs, monitor change, and continue to focus on community safety in order to reduce harms. L'un des rôles clés de la santé publique est de surveiller la santé des habitants d'Ottawa. Et à ce titre, Santé publique Ottawa a récemment fourni une surveillance renforcée lors de l'interruption de services relatifs à la consommation et au traitement dans la communauté. And this surveillance that we did, as there were some consumption treatment services closed for a period in Ottawa, provided some unique insight into what the experiences were for the community during this time. And it's helping to inform recommendations to address the future closures. For example, partners are interested in growing a coordinated approach to outreach, as well as enhanced peer and staff outreach that would be easily accessible through one point of call and available for more hours of the day. People are also noticing and agreeing upon the need to continue to look for safe spaces for individuals to be during the day and overnight. These two identified needs for enhanced coordination of outreach and safe spaces are currently being worked on with partners to look at how we can address some priority. So lastly, I do want to welcome our new Associate Medical Officer of Health, Dr. Emile Azuma Precurl, whose appointment was approved by City Council following your last meeting. And that was, of course, something where City Council does the appointment, but we also have to wait for the minister to do the last appointment. That's pending. But Emile comes to Ottawa Public Health as a recent graduate from the Northern Ontario School of Medicine's University, that Public Health and Preventive Medicine program there. Certainly before that, he did get to know Ottawa as he studied medical school here after completing degrees in music and physics, if you want to ask him about that. And he completed a master's degree in public health at the London School of Hygiene and Tropical Medicine. His training has taken him to a number of different health units and to the provincial and federal level. So we really appreciate that he's choosing to work with us. And nous attendons avec impatience les contributions d'Emile à l'équipe de Santé publique Ottawa. Bienvenue, Emile. And that concludes my report. So I'm happy to take any questions. My computer did shut down, so I'm going to rejoin so people can see me online. Not sure why, but I can take questions.
Member Gower.
Really excited to hear about the Health and Housing Forum. I'm wondering if you have any previews of kinds of organizations that would be participating in that.
Yeah, so we are starting with a fairly small group of leaders in the healthcare sector, for example, hospital leaders, certain, people who've been working in this area in the community as well. Community health centers are part of the work through the Ottawa Health Team and other Ontario health teams. So Four Rivers West, which I think is your areas they're working in, as well as Archipel, which is to the east. So making sure those health teams really speak for groupings of health service providers. And then on the housing side, the city community social services has a it's hard to speak about health and housing, has a housing and homelessness leadership table that is informing city work. And so drawing from that group to make sure that there are leaders there. Of course, Ottawa Community Housing, others we've been partnering with around with, like, for example, Salis. And certainly, I think many people are part of the solution. I think starting there, getting some information that we can share with others will be important if we truly want to speak with one voice about the needs in Ottawa. This is just the beginning.
Okay, thank you. I'm looking forward to seeing the results and the feedback from that. It's great.
Thank you, Member Gower. I'm not seeing any other questions. So is this item received?
See.
Thanks, everyone. We will move on to item 7.3, which is the 2024 Nutritious Food Basket and Food Insecurity. We have a staff presentation and then a few delegations.
Hello, my name is Erin Saluski. I'm the Program Manager of Chronic Disease and Injury Prevention Unit. And I'm joined here today with Emily Koja, the Senior Nutritionist and Chronic Disease Prevention Team Supervisor. We are here to talk about food insecurity and Ottawa Public Health's role in monitoring food affordability locally. Food insecurity is not having enough money to buy the food you need. It can range from worrying about running out of food, eating lower quality or smaller quantities of food, or skipping meals altogether. Food insecurity has negative impacts on both the health of adults and children. This graph on the slide shows the prevalence of household food insecurity from 2019 to 2023. You will notice that food insecurity rates were lower during 2020 and 2021. This was due to government assistance through the pandemic with the Canada Emergency Response Benefit, or CERB. Following the discontinuation of CERB, household food insecurity has been significantly increasing. In 2023, nearly 1 in 4 households experienced food insecurity in Ottawa, compared to 2022, where 1 in 7 households experienced food insecurity. Locally, this is being felt by community agencies who provide food. At the recent Community Services Committee meeting, we heard many community delegates sharing the crisis level they are seeing in the city related to food insecurity and their inability to meet the needs. Next slide. Boards of health are mandated to monitor food access and affordability at the local level, as outlined in the Population Health Assessment and Surveillance Protocol in the Ontario Public Health Standards. In order to achieve this mandate, like other public health units, OPH monitors the affordability of food by conducting the Nutritious Food Basket survey. We've conducted this survey every year since 1998, except for 2020 and 2021 due to the pandemic. This data is used by OPH and external partners to raise awareness about the impact, prevalence, and causes of food insecurity to support programs and influence policies. This year, for the first time through a collaboration between the Ontario Dietitians in Public Health and Public Health Ontario will combine food affordability data from all public health units into a single report to increase accessibility and improve collective efforts to influence policies. I'll pass the mic to Emily to talk about this year's Nutritious Food Basket results.
Thanks, Erin. So in 2024, the Nutritious Food Basket survey results show that the monthly cost of healthy eating for a reference family of 4 is $1,244. For a family of 4, this represents a 4% increase from 2023 and a 10% increase from 2022. The NFB results aren't meant to be used as a budgeting tool or to inform purchasing patterns or to be used as a nutrition guide, but rather we use these results and present them in the context of income to highlight the inadequacy of incomes for certain population groups. While it's true that the cost of food is increasing, the real crisis is that incomes are not increasing at the same rate. Year after year, our results consistently show that individuals and households with incomes from low-wage employment and social assistance supports cannot afford the basic cost of living, including nutritious food. Many low-income households have little to no money left at the end of the month for necessities like childcare, transportation, medication, clothing, or dental care, etc., after covering their rent and food expenses. And this is highlighted in our income scenarios. We have 12 income scenarios in the Food Insecurity and Monitoring Food Affordability report and are also available on our website. These highlight a variety of different individual and family circumstances and makeups. And so I'm going to be highlighting 2 of the scenarios from our report in the coming slides. Before I do that, I also want to note that this year we have 2 versions of our income scenarios that you'll see in the report, and they use different sources for housing costs. So similar to what we've done in previous years, we've used the data from the Canadian Mortgage and Housing Corporation, otherwise known as CMHC. And this data provides an average of current rental costs that are being paid by tenants in the city. What's new this year is that we're also including rentals.ca data, and this represents the higher cost of current market rent for tenants that are seeking vacant units. So rental costs for a new tenant are substantially higher than those that have been in their housing location for a longer period of time because they're protected by rent control, and we know that affordable units are also the least available. So this is one of the scenarios I'm going to highlight from our report, and I'm going to just provide some additional detail to give you a story behind the numbers that you're seeing on the slide here. So this is a scenario about a man who was once a dedicated personal support worker. His life shifted dramatically when his mother fell and broke her hip. He now spends his days balancing doctor's appointments, physical therapy sessions, and managing his mother's daily needs. Unable to continue working as his job as a PSW while also supporting his mother, he applied for government assistance through Ontario Works. With the money he's receiving from OW and other benefits, his income totals just under $900 per month, as you'll see on the blue bar here. While he is actively looking for work that will accommodate his new schedule, he's limited in terms of the hours he can commit to. He's also worried about OW's clawback policy, where benefits he receives are reduced based on his employment earnings. He's lived in his bachelor apartment for 7 years now. And because he's a long-term tenant, the middle bar applies to his current situation using data from the CMHC. And his rent is just over $1,100 per month. This means that he's spending 133% of his income on housing alone. After also paying for nutritious food at just over $400 a month, he's left with a deficit of $730 each month. And this is before paying for other basic necessities like potentially heat and hydro, transportation or clothing costs, and any other expenses he might have in a given month. This is also being conservative, using the data from CMHC. If he were to need to move closer to his mother, for example, to provide her with care and had to pay market rent, he'd be looking at closer to $1,700 as the average cost of a bachelor apartment in the current market, making his deficit even greater at over $1,200 every month. These numbers, show that it's not possible to meet basic needs of life with this level of income. To keep his head above water, he's turned to his local food bank where staff and volunteers are kind, but the process reminds him daily of how precarious his situations become. The quantity and quality of his food intake has been decreased, and he's been often forced to skip meals to make ends meet. He's also had to rely on high interest payday loans, offering quick cash to ensure that he can remain housed and pay his rent, but trapping him in a cycle of debt. So this next scenario is an example of how food insecurity doesn't only impact families whose main source of income is from social assistance. A recent survey conducted by the Ottawa Food Bank on food bank usage found that close to 40% of respondents using food banks are working full or part-time jobs. So this is a family of 4 consisting of 2 parents, an 8-year-old girl and a 14-year-old boy. They've arrived as refugees in Canada. The parents were both professionals in their home country, but here in Canada, their credentials are unrecognized. One of the parents has found a full-time job paying minimum wage, but offering no benefits in order to support their family. The other parent is supporting the children and integrating into their new normal in a new country and trying to learn a new language at the same time. This family has really struggled to find affordable housing that meets their needs. And so in this case, the far right bar on the graph is the only one that would apply since they're new tenants and subject to paying current market rent. So after they've paid for their rent at close to $3,000 per month, as well as nutritious food for their family at over $1,200 per month, they're left with a monthly deficit of almost $800 every month. As refugee claimants, they're also not eligible for federal benefits like the Canada Child Benefit, and they're reluctant to apply for government social assistance because of the impact of this on their status with the Immigration and Refugee Board of Canada. Their family ends up using their savings, visiting the food bank, and tapping into other subsidized programs to make ends meet. So as you can see from these scenarios, there simply isn't enough money to afford basic necessities in addition to nutritious food. And so what ends up happening as a result for many individuals and families is food becomes a discretionary expense. People can't prioritize purchasing nutritious food when there are so many other unmet needs. And this results in individuals and families facing food insecurity, which has a tremendous impact on the health and well-being of the residents in our city. And just repeating what Erin said earlier, that almost 25% of households are food insecure in Ottawa, and these numbers give you an indication of why that is. We know food insecurity is rooted in poverty, and it can't be adequately solved by food programs. Food programs provide emergency support that is needed in the community, but they're Band-Aid solutions to a broader systemic issue. We also know that emergency food programs aren't able to keep up with the significantly increased demand that they're currently facing. Policies are needed to help people afford the cost of living. Things like a basic income for working age adults, jobs that offer livable wages and benefits, increases to social assistance rates that reflect the cost of living, and access to affordable housing and childcare. In terms of next steps at OPH, we're going to continue to raise awareness of this issue by sharing our 2024 nutritious food basket survey and food affordability results on our website, through our social media platforms, as well as through an infographic. We'll continue to monitor for policy and legislative opportunities for this board to consider supporting, such as federal and provincial government policies and programs to help residents afford the cost of living to meet basic needs. We'll continue to collaborate with our community partners to address food insecurity in Ottawa through the provision of this data, as well as evidence and subject matter expertise in food insecurity. And we're also working closely with community and social services, as well as other city departments on the implementations of priorities within Ottawa's poverty reduction strategy that focus on reducing household food insecurity. That's the end of our presentation. Thank you for the opportunity to speak here.
Thanks very much. We will have an opportunity to ask questions of staff, but we're going to go to the delegations first. So first we have Swasan Al-Rafi joining us online, I believe.
Hello, everyone. Thank you for the opportunity. My name is Swasan Al-Rafi. I'm the manager of the Community Safety Wellbeing Plan in the city of Ottawa, and I'm happy to be here to highlight the linkages between the nutritious food basket report and the recently passed poverty reduction strategy. As you may know, the poverty reduction strategy has been passed by City Council on October 30th. I would appreciate if the slides can also be displayed as I speak.
Yep, we will get those up for you. Just one moment.
So I can continue as they come up. So I'm here to speak about the poverty reduction strategy in a very quick summary, but highlight the linkages with the report that has been shared by Erin's team. Next, please. The food security pillar of the poverty reduction strategy is one of 5 pillars, including employment, financial security, economic development, and integrated simplified pathways. And just like the team concluded their presentation, food security is linked to so many other pillars that we try to include in the poverty reduction strategy, recognizing that food insecurity has to be solved or addressed using a holistic approach. Under the poverty reduction strategy, there are priorities that are interlinked, assuming that food security and other pillars are mutually enhancing pillars, and therefore any changes into financial security, employment, economic development, or having wraparound services available to persons living in poverty will have a ripple effect into food security insecurity data that have been presented. Next, please. The food security pillar focus in the poverty reduction strategy focuses on working with the community and building on what exists. And so in there, you will find a priority on creating a community-led mechanisms of coordination, and that will be reflected as a short-term activity in 2025 by holding a food forum, where OPH will also be one of the key stakeholders attending the forum. We will be supporting food banks and community food programming under the long-term strategy, but also working to address equity issues in food insecurity in partnership with OPH as well, addressing the complexities of racism and food insecurity. With the team that presented today, we are collaborating in 2025 and 2026 to work as a working group that brings in multiple partners in the city, including community funding, the OPH team, as well as the poverty reduction strategy team, to work together and address and integrate food security in long-term strategies and plans of the city. And this will allow us to examine data and evidence as well. We are in support of the data presented today, and we think that it is important data that will continue to inform the work that we do under the strategy, under the food security pillar. Thanks for the team again, and we're looking forward to continuous collaboration with the team in the very near future. Happy to answer any questions.
Great, thank you. I'm not seeing any questions for you, but thank you very much for your delegation. Oh, sorry, we do have a question. Member Kavanagh.
Thank you very much. And thank you very much, Alston, for all your work. I appreciated your work on gender equity and I can't help but think of a link here in terms of gender, in terms of the poverty that we're seeing and just the overall needs in the community. Do you have any comment on that?
Thank you very much for the question. No, definitely there is an equity lens that has been highlighted in the poverty reduction strategy. We recognize the disproportionate impact of poverty on women, particularly those coming from Black, racialized, and Indigenous backgrounds. The strategy uses an intersectional lens, meaning that there are a couple of priorities in the strategies that focus on that disproportionate impact. An example of that is economic abuse that is targeting Black and racialized women. Also support to employment and financial independence and empowerment. So definitely the strategy recognizes that gender lens.
Thank you very much, and I appreciate all your work on this project. It's huge, and it's a big step forward that we're having this conversation, and particularly I'll talk to staff about that too, but the need for a basic income just so that people can get by, I think has been emphasized, and I appreciate that. Thank you.
Thank you, Member Kavanagh. I'm not seeing any other questions. So again, thank you for your delegation this evening. We will move on to the next, Rebecca Doris, who is also joining us online, I believe. You have 5 minutes, Rebecca. Please go ahead.
Thanks. Sorry, I just had to rejoin as a panelist, so just catching up on all that. Hello, my name is Rebecca Doris. I'm the coordinator of the Ottawa Community Food Partnership, also known as OCFP. OCFP is a network of Ottawa-based nonprofit agencies working together to improve food insecurity outcomes across Ottawa. Individually, OCFP partner organizations work to increase access to good food, whether that be through charitable needs, community development, or otherwise. They work with community members to co-design programming and work towards much needed systems change. They do this incredible work and so much more with only a small amount of financial support from governments that is disproportionate to the amount of finances that they have to find to put forward to directly address food insecurity in Ottawa. We are one core component of a broader citywide food systems approach that is needed to bring about long-term change in the face of rising complexities that affect food insecurity. City Council approved the poverty reduction strategy last week, which will lead to a strengthening of a systems-based, cross-sectoral, collaborative approach to addressing food insecurity in Ottawa, which is integral to OCFP's mission. As we saw in OPH's presentation of the 2024 Nutritious Food Basket and Food Insecurity Report, food insecurity rates in Ottawa have nearly doubled since last year. We see that again, food insecurity is worse amongst marginalized populations like racialized residents and those living with disabilities. Food is becoming increasingly unaffordable and inaccessible for residents of Ottawa, and it is community-based food organizations who bear the burden of providing increased emergency food access to those who need it. Underfunded and overburdened charities and nonprofits, like those that are part of OCFP, are having to engage in band-aid solutions to address food insecurity through food banking and through other approaches. In many cases, other vital programs have to take the back seat as more time and resources are diverted to the overwhelming need of food banking. We were asked by counselors of the Community Services Committee last week why we are asking for more money to fund these Band-Aid solutions. As healthcare professionals and advocates, I know everyone here tonight understands what happens when a wound is not properly bandaged or treated in a way that prevents infection. Food insecurity is an urgent public health issue. Food security organizations are advocating for the combination of policies, programs, and community models that address the root causes, but we cannot simply skip the adequate resourcing of immediate emergency food provision either. Similar to an untreated wound creating infections and further health complications, under-resourcing immediate supports that are needed to stabilize residents and communities will result in worsening health and undignified conditions for the most marginalized members of our society. Income-based policy options, such as those presented in the report, are needed, and we need OPH and allies to help us advocate for immediate funding for food charities to effectively address the consequences that food insecurity are having on our residents right now. We know that poverty, specifically insufficient income and the social inequities that underpin poverty, is the root cause of food insecurity. An increasing amount of people do not have enough income to make ends meet. Cost of living soars, low wages, precarious work, and abysmal social assistance rates, if they cannot work, are present. Collaborative advocacy for income-based policy solutions is necessary. OCFP and OPH are aligned in our advocacy efforts, and we've identified the need to work together, especially to advocate for income solutions at upper levels of government. For example, obviously the Ontario government mandates social assistance rates and minimum wages, which are currently far from livable and place people below the poverty line. We also need to advocate to federal government responsible for creating and implementing benefits like the Canada Disability Benefit and introducing the much needed grocery and essentials benefit. It was very validating to see that not only Council, but the Board of Health did a lot of advocacy to support Bill C-223 for a basic income, which could have made a really big impact. But even though that wasn't accepted, we still need to do a lot of advocacy going forward for these higher levels of government.
Rebecca, you are at time, so if you could just quickly wrap up.
Sure. Yeah, absolutely. So basically, overall, we understand the impact of food insecurity on long-term health and obviously the cost of governments as well. We appreciate Ottawa Public Health's commitment to continuing to address and monitor food insecurity in Ottawa, and we look forward to working with OPH and Council as we progress the poverty reduction strategy going forward. Thank you.
Great, thank you so much. Any questions? Member Carr.
Hi, Rebecca. Thanks very much for your presentation and delegation. Much appreciated. 100% agree that we need to work to advocate for those upper levels of government and that a systems approach is needed. You mentioned working with upper levels of government in terms of those advocacy for those items that relieve poverty. You mentioned specifically, for example, UBI. In terms of the work that the OCFP does, are you doing any advocacy to upper levels of government with respect to that food systems piece, like in terms of how we rethink food overall, like manufacturing, production, any of those big pieces in addressing the higher level issues of the food systems?
I would say as a partnership, as a whole, we aren't currently doing that. Our capacity is quite small, but some of our partner organizations are. For example, Just Food is based in Ottawa, and a lot of our organizations do have an Ottawa-based focus, but we all know, right, that going up to levels of government, we need to address the policies that may be beyond the municipal government. So we would certainly like to, but we're not quite grassroots, but we're pretty small in that capacity. We would love to be able to do more. Part of the issue of doing more is that a lot of these organizations are doing this work off of the side of their desk. So they may be running emergency food programming full time with very little staffing. And so unfortunately, a lot of this advocacy is kind of pushed to the side. So yeah, we would absolutely love to do more. And so if there's any ideas going forward, we would love to continue to chat with the Board of Health, members of City Council, the Community Services Committee, whoever is interested about how we can make that happen with limited resources.
Yeah, it's definitely challenging, isn't it, when you think of the role of the municipality, the impact we can see from a public health perspective on the lack of nutrition and the total failure of our food system approach overall. But when everyone's just throwing Band-Aids at it all the time, it's really difficult to move forward. Thank you very much for all the work that you do.
Thank you so much for questions. Thanks.
Great. Thank you, Member Carr. I'm not seeing any other questions. Thank you for your delegation and for your kind words, recognition about OPH's role. Thanks.
Thank you.
Next delegation is Rachel Wilson.
Good afternoon or evening by now, I guess. My name is Rachel Wilson, and I'm the CEO of the Ottawa Food Bank. We represent a network of 98 food programs across the city, working every day to support individuals and families experiencing food insecurity. The nutritious food basket is a critical tool for the Ottawa Food Bank. Annually, it helps us understand the rising food costs, gauge the level of service required from the network, and project our own costing. The Nutritious Food Basket Report validates the level of food insecurity we see in the network, both statistically and anecdotally. With the rise of 38% in the nutritious food basket since 2019, it's not surprising that there's a simultaneous healthcare, affordable housing, and food security crisis. They are deeply linked. As noted, 1 in 4 households in Ottawa are struggling with food insecurity compared to just 1 in 7 a year ago. The Ottawa Food Bank has also seen the level of self-reported severe food insecurity rise from 32% to 65%. That is a 90% increase. We've seen a staggering 90% increase in visits since 2019, and we simply cannot keep up with demand. Community food banks in our network are stretched so thin that 40% of them are turning people away. As things stand, the Ottawa Food Bank will have to reduce the amount of food we distribute starting in January 2025. Without immediate new funding, we'll be forced to cut back at a time when more and more people are coming through the doors. But this crisis is about much more than just food. It's about the health and stability of our entire community. When people can't afford food, it affects their ability to work, to study, and to live with dignity. Food insecurity puts a strain on every part of the city, from shelters and social services to healthcare. We're hearing from shelters, children's programs, even the police. Food insecurity is becoming the biggest barrier to addressing other needs in our community. None of the important work on poverty reduction can succeed unless people's most basic needs are met. Many agencies have serious concerns about the next few months. Some are at risk of closing because of a lack of funding. Others are unsure how they can turn people away. Without question, residents in our community will be going hungry. If this continues, we will see people lose their housing and we will see a decrease in mental and physical well-being. This is becoming a public health crisis. When we consider the almost 20,000 children who will need a food bank this month, we will experience a generational impact. We know more food through the charitable sector won't solve the issue. We've been doing food for 40 years. That's why the Ottawa Food Bank supports Ottawa Public's health call for comprehensive income-based solutions and policies that address the underlying issues of poverty in our community, as outlined in their report. The city leadership also has the power and relationships to push provincial and federal counterparts to see this as a health crisis that needs their immediate focus and support. Unless this pressure is put on all levels of government to do their part, it will continue to be downloaded to municipalities and charities. This is not just about feeding people today, it's about preventing an even deeper crisis. I encourage each of you to consider the voices of those who are most affected by poverty and food insecurity, and to continue to recognize the link between health outcomes and the pressing need for income-based systemic solutions to address chronic poverty levels in all communities. We must work together at all levels to push for these much-needed policies. Ottawa Public Health is a critical partner for the Ottawa Food Bank. We have jointly supported each other's work for several years. They provide important data for our work, guidance, collaboration, and in-kind support. We're pleased to share our work and data, such as the Voices of Community Report and our hunger count, with the Ottawa Public Health Unit. The nutritious food basket is a key tool for the Ottawa Food Bank, and we thank the Ottawa Public Health for their commitment for this work every year. Thank you for your time.
Thank you, Rachel. Any questions? Member Kavanagh.
Thank you, Rachel, for all the work that you put into the strategy as well as your ongoing work, of course, with the Ottawa Food Bank. Very much appreciated. I think the most interesting graph that I saw today was the fact that in 21, 22, when the CERB was in effect, that the incomes were better, so therefore not as much need. Did you see a difference at the food bank during that period when CERBs were in effect?
We absolutely did. We saw the number of people needing to access a food bank level off, and in some cases dip. And that's because we know very clearly that they were receiving the income they needed to be able to purchase the food that they wanted, when they wanted, where they wanted. So it absolutely points to the fact that a basic income would dramatically decrease the number of people needing a food bank.
Yeah, I think it was if I want to call it an experiment, it was very much a visual of what it could do. So I really appreciate your advocacy for that, because I know you don't want to be kept in business. I know that you want to be put out of business, and that income is the way to do it. Thank you.
Thank you.
Thank you, Member Kavanagh. Member Gower.
Thanks, Chair. I know there was quite a long discussion about food insecurity and other issues around poverty at last week's Community Protective Services meeting, and it was a difficult meeting. And thank you to all of the delegations today who've spoken. Rachel, what I wanted to ask is just, I think there's still a large misconception in the general public about who is using food banks and why. Could you talk a little bit about, like, I think a lot of people think of food banks as an emergency and something people might use in the short term. What are you seeing, and are you seeing any trends as to, I guess, chronic need for food bank assistance?
Yeah, and you're absolutely right. There still very much is a misconception about who is accessing a food bank. And it's important to remember that there are food banks in every community in this city, and all of them are seeing astronomical numbers of people going. So what we are noticing of trend is more people who are employed needing to turn to a food bank, particularly those who might be at a minimum wage, which doesn't come close to a living wage or a rental wage here in the city. So that is an increase that we're certainly seeing. We've always known that individuals are much more prone to food insecurity with the single income, but we continue to see families and single parent families needing to access food banks. And to the question around chronic usage versus episodic usage, we know chronic usage is driven by social assistance rates. The fact that they have not kept pace means that anywhere between 40 to 50% of those who access a food bank are on some form of social assistance. There are many people who, maybe will need to access a food bank 1, 2, or 3 times a year, but there is a large number who are needing to use it once a month. We saw the last 2-3 years, people are needing to access 2-3 times a month, and that's driven by the low social assistance rates.
Yeah. Okay. You use the word downloading in your comments about other levels of government downloading responsibilities around social assistance and other poverty reduction tools that they should be providing. Can you give us a sense for your organization? How big an operation is the Ottawa Food Bank now? How many staff and volunteers, and how much of a budget do you have on a yearly basis?
Yeah, We are a $30 million organization that's grown since 2019, where we were a $15 million organization. So that gives you a sense of the scale and the level of need that's grown in the last couple of years. We rely on over 3,000 volunteers every single year. Our staff is around 50 people. And it's really important to note that no level of government has a mandate for food security, which makes it incredibly challenging for our organization to advocate when you need to go to 6 different departments at all levels of government. It's very easy to download the issue back down to the charity level. And really, that's what we're seeing at the local level, is that it is being downloaded to our donors and our community to support our efforts, because there are many gaps that have been left by all levels of government in addressing this issue.
Okay, thank you. Thanks,
Thank
Chair.
you.
Thank you, Member Gower. Not seeing any other hands. So thank you, Rachel, for being with us tonight and for all the work you're doing and that the Ottawa Food Bank is doing. And I want to thank all the delegations who came out to speak tonight for what you're doing to tackle this devastating issue in our community. So we're going to go back to questions to staff, if any members have questions. Member Carr.
Thank you very much. Thank you for the presentation and the discussion. I have a question. When I was reading the documentation and we talk about the crisis that is in food insecurity, and within the notes, there is a specific notation within the report that said food programs are not the solution. And there's reference to the announcement of the federal government in terms of a lunch program. In my experience, the one value that can happen from a school food program is not necessarily the insecurity piece, but the nutrition that it can bring in families where there's a nutrition deficit. And I wondered if OPH can comment on that, on the value overall of a school breakfast or lunch program.
Thanks for your question. Definitely agree with you completely. There are many benefits. You know, while a school food program may not address the root causes of food insecurity, it provides many other benefits like health and learning for children, the opportunity to provide a healthy eating environment, role modeling with teachers. So there are many benefits that supporting families that are in a crisis right now with providing food to their children. It doesn't address the root cause, but it still does provide food to children in our communities that makes a difference in their lives. So we're definitely in support of that. And we work closely with the Ottawa Network for Education, and that's they're the ones that lead the student nutrition program currently. And so with the federal program that's being worked out with the provincial government at this point, we'll continue to work with them moving forward when funds are received for the student nutrition program when that happens.
Okay, great. Just a couple other questions. You mentioned CERB specifically, and noticing the decline in food services, or I believe as Rachel Wilson talked to it about the leveling off, and Councillor Kavanagh had a question on that. Is it definitive that that is a causal relationship and not a correlational? And the reason why I'm asking is, not only did CERB provide sort of that universal basic income, but it was also during a time when people were in isolation. They weren't perhaps going out of the house at all. And so is there specific evidence that that was the reason? Just because there were so many variables during those times where people weren't leaving the house, maybe not, food banks weren't open the same hours. Can you speak a little bit to that evidence?
I'm not up to date with that evidence. And I think, there were a lot of factors that affected, the services and the needs that people had during that time. We did hear from Rachel that they saw a decrease in some cases for their for food bank usage, but I'm not familiar with that exact evidence.
Okay, thanks. I mean, I strongly suspect, I think as everyone does, that value, and I'm a big supporter, of course, of, universal basic income, but I just wondered if there was a little bit more. Of course, you're not interviewing people at the food bank regularly, but I just have one last question, if that's okay.
Member Carr, we can get back to you. They are different data sources. So measuring food insecurity is one data source, and then trying to understand the recipients of CERB, what was their change in food security. So I think there are some sources where people have looked at what that meant for people who received CERB, and it certainly did. That income was spent on food to some degree, but that we can follow up with you.
Okay, I would like that. I always love to have data to quote over and over again. Thank you. And then just my last question, just in terms of, it was a very interesting report and to read it. And, one of the struggles I find in my role as a counselor and being involved in various initiatives is that, we've seen this growth of a patchwork of different food programs, whether it be food banks, soup kitchens, Meals on Wheels type programming. And oftentimes you're helping constituents, sort of navigate where they can, grab something from a food cupboard and everything else. So we've really, developed this landscape of a whole bunch of hybrid of Band-Aid programs. And it's really challenging. And you see those public health impacts. I mean, I was shocked to see that we had scurvy is back, for example. My parents used to always tell me I would get that for not eating citrus, but the fact that this is back, it's terrifying to see the impacts of public health. Where, other than that advocacy to upper levels of government for those sort of income-based programs, housing and homelessness, do you see anywhere else where public health can play a greater role in helping to address this?
Thanks for the question. Yeah, so from our standpoint as staff at OPH, the biggest thing that we can do is provide data and evidence and raise awareness of the issue. And of course, as you heard in some of the delegations, continuing to work with our partners and support partners in their efforts in looking at policy decisions that affect a broad range of things from income to other ways that people can afford the cost of basic living. And continuing to monitor for outreach opportunities for this board as well as the opportunity now that we have to work with community social services on the poverty reduction strategy. So looking at different city policies and applying a food insecurity lens to those policies is a new opportunity for us that we're excited to work on moving forward.
Yeah, that's great. Thank you very much for your presentation.
Thank you, Member Carr. I'm not online. We have a question from, Member Chung.
Thank you. I was just wondering, I often hear about, say, teachers at schools confiscating unhealthy food items from that students bring to school. Is there any messaging or anything? Does OPH work with the school board? Because perhaps that child may be bringing those items because there aren't any other healthier choices that they can afford. So then, the child may be bringing those food items in because that's the only items that are in the house, and that can keep them full. So is there any sort of kind of messaging or liaising between school boards and OPH and
Thank you for your question. Yes, so we do work through our school board liaisons to work with our school boards in providing messaging. So there's some opportunities coming up in the new year to do presentations for teachers to give some of this messaging. We have been hearing that through comments on our social media as well. So it is something that we're going to be looking at addressing through in-services with teachers and other messaging that we'll put through our school board, working with our school board liaisons at Ottawa Public Health.
Thank you. And are the teachers or are they advised to kind of do some investigating or questioning, just kind of asking why those items are being brought to school so that they could perhaps point them in the direction of the assistance they might be able to provide?
So our messaging is really that teachers shouldn't be involved in questioning children about the food that's in their lunchbox, just because the impact that can have on the children when it's not their choice in terms of what they provide. So there is an opportunity for us to work with parents as well. And so that's another part of our work, is to talk to parents and provide key messages to them about, you know, what's in a healthy lunch. We have information about that on our website, and we put that out through social media, but we certainly wouldn't want teachers to be commenting on the food that's in a child's lunchbox for the reasons that you stated.
Thank you.
Thank you, Member Chung. Member Gower.
Thank you, Chair. Just a quick comment. I really appreciated the use of the rentals.ca data this year to give maybe a more realistic view of what new residents in particular might be looking at for rents. And I also think it helps give us an idea. I mean, there's some areas of the city like West End, which I represent, Stittsville and Canada. We tend to have a much higher average rent than Central Ottawa. So I think it's illustrative of why so many people are experiencing food insecurity when the cost of housing is exasperating all the other factors. So thanks for including that. It's helpful. Thanks, Chair.
Thank you, Member Gower. Not seeing any other hands, but I just wanted to add my thanks for the report. Certainly good information for us all to have as we tackle many issues in the city. So thank you. Is this item carried? Great. Thanks, everyone. So we'll move on to item 7.4, climate change and health vulnerability assessments. We have a presentation from staff on this as well.
Good evening. My name is Emily Morrison. I'm the program manager with the Healthy Environments team. We do have some infographics available by the door for board members who would like them.
Sorry, Emily, did you want to just approach the mic a little bit more?
I'm sorry.
It's better.
Just a little closer.
Thank you.
Okay. So thank you for the opportunity to discuss climate change and human health risk assessments. Je vous remercie de votre attention. This evening, I will highlight how climate change impacts health and the importance of understanding these risks for our community. I'll also share opportunities identified through the climate change and health vulnerability assessments to enhance our collective response. Climate change is the greatest threat to human health of the 21st century and already affecting the health and well-being of many Canadians. As climate patterns shift, we face more frequent and intense heat waves, extreme weather events, poor air quality, increased food and waterborne illnesses, and the spread of vector-borne diseases. These changes pose significant health risks, particularly for residents who face disproportionate health impacts. Ottawa Public Health conducted climate change and health vulnerability assessments. While these assessments are required under the Ontario Public Health Standards, they are also a priority for Ottawa Public Health, as they align closely with our strategic plan. Ottawa Public Health has a unique role in assessing health impacts and sharing findings with our community, with the goal of identifying and prioritizing key health risks. Strengthening community resilience requires close collaboration with community partners, local governments, and health organizations. These assessments provide a foundation to build on through collaborative work with partners, such as Ottawa Public Health's co-location of 2 staff with the City of Ottawa departments to integrate health into climate mitigation and adaptation policies, such as the new zoning bylaw provisions. Together with these partnerships and other initiatives, we can develop targeted interventions, advance climate mitigation efforts, enhance community resilience, and support equitable health outcomes. The climate change and health vulnerability assessments assess the health vulnerability status of Ottawa residents and identify ways to address the health impacts of extreme heat, vector-borne diseases, food and waterborne illnesses, wildfire smoke, and ultraviolet radiation related to stratospheric ozone depletion. Key findings and adaptation strategies from the assessments are already informing current work and will guide future planning for Ottawa public health activities and the City of Ottawa's climate resiliency strategy. Ces évaluations comprenaient des présentations en ligne, des ateliers, des interviews et des sondages avec plus de 90 partenaires communautaires en vue de déterminer les mesures que les résidents, les communautés et les organismes pourraient prendre pour améliorer la résilience face aux conséquences des changements climatiques. Climate change is complex and requires a layered approach with both mitigation and adaptation strategies. Mitigation strategies are used to reduce greenhouse gas emissions to slow climate change. These are essential to avoid catastrophic impacts to our communities. Adaptation strategies involve preparing for, responding to, and adjusting to the climate impacts that are already occurring and will get more severe. Building resilience means strengthening our capacity to anticipate, withstand, and recover from climate change impacts. Another way of thinking about it is that climate mitigation helps us avoid the unmanageable and adaptation helps us manage the unavoidable. While today's focus is on adaptation, mitigation is equally important, and Ottawa Public Health can play a role in advancing mitigation efforts by demonstrating their importance for long-term community health and resilience. Ottawa Public Health is bringing forward 3 recommendations for consideration by the Board of Health to enhance community resiliency and health equity, as outlined on this slide. Tous les résidents d'Ottawa sont impactés par les changements climatiques, mais nous avons identifié certaines populations qui ont des conséquences sur la santé disproportionnées associées aux 5 risques climatiques indiqués sur l'écran. Climate change increases risk for people who already face challenges due to factors like age, ethnicity, occupation, income, housing, and health status. Mental health is an element of climate change resiliency, and these risk factors impact people's ability to cope with the mental health effects of climate change. Emotional responses to climate change, such as fear, anxiety, and sadness, can be especially pronounced among those affected by health inequities. Additionally, concurrent extreme events, such as extreme heat, food and waterborne illness, and wildfire smoke, can further strain people's ability to cope with the health impacts of climate change. The next slides will explain key findings from the climate change and health vulnerability assessments. More extreme heat days are associated with an increase in hospital visits and admissions. Heat-related illnesses such as dehydration, heat stroke, heat exhaustion, and deaths are preventable if prevention strategies are implemented. Ottawa Public Health found that some equity-denied groups and partners have greater difficulty accessing or are unaware of Ottawa Public Health's climate adaptation resources, such as the online interactive map of places to cool off or the multilingual Beat the Heat fact sheet. Additionally, people experiencing homelessness face significant challenges when accessing cool spaces and drinking water because of stigma, restrictions, and discrimination. To reduce health impacts of extreme heat, collaboration is essential to enhance existing strategies and initiatives aimed at protecting Ottawa's disproportionately impacted populations to build cooler, more resilient communities. Additionally, funding further promotion of resources such as the Beat the Heat fact sheet and cooling strategies such as using air conditioning, seeking shade, and using beaches or pools will help increase public awareness and support effective heat protection measures. Warmer seasons create favorable habitats for disease-carrying insects like mosquitoes and ticks and support their population growth and expansion of their geographic range. It can also increase human outdoor activities in areas where these insects thrive, increasing the risk of exposure to vector-borne diseases. To reduce health impacts, Ottawa Public Health must increase awareness of vector-borne diseases and preventative measures, such as wearing long pants and sleeves, applying DEET or a keratin insect repellent, having well-sealed windows and doors, removing standing water outdoors, doing full body tick checks, and staying on the trails in natural areas. Additionally, Ottawa Public Health must ensure the West Nile virus prevention program remains responsive to the seasonal changes that can cause increasing or new mosquito populations. Canada is experiencing longer wildfire seasons due to warmer temperatures, more extreme weather, and drier conditions. In June 2023, wildfire smoke from Northern Ontario and Quebec resulted in 8 days of very high concentrations of air pollutants in Ottawa and air quality health index values in the high and very high health risk ranges. Wildfire smoke exposure, like other smoke and particulate exposure, is associated with respiratory illness and infections, premature death, and negative prenatal and birth outcomes. To reduce health risks from wildfire smoke, Ottawa Public Health must further promote protective behaviors, such as using the Air Quality Health Index, weather apps, seeking cleaner airspaces, closing windows and doors, and canceling or rescheduling outdoor activities when needed. An equity-driven approach is essential to address barriers faced by residents disproportionately affected by wildfire smoke, ensuring they can access information and implement protective behaviors. Climate change is expected to increase the risk of food and water contamination, leading to gastrointestinal illness. For example, foodborne illnesses are likely to increase with warmer seasons as more people may participate in outdoor food preparations, such as barbecues, where food may sit out longer or not be stored at safe temperatures, allowing bacteria to spread more easily. Additionally, Legionella is a climate-sensitive pathogen that grows in warm, stagnant water and is a risk in building cooling systems. With more hot days and more building cooling demands, there's more opportunity for its growth and potential spread. To reduce the health risks of consuming contaminated food or water, it is essential to build on existing promotion of private well water protection and public education on recreational water quality and safety. Partner collaboration is crucial to address barriers faced by equity-denied groups and to implement effective interventions. Ultraviolet radiation from the sun can lead to skin and eye cancers. Ottawa's melanoma skin cancer rate is 34% higher than the provincial average. Behavioral changes due to warming conditions can increase the number of people with skin cancer. To reduce skin and eye cancers, Ottawa Public Health must promote sun protective behaviors such as wearing sunscreen, UV protective gear, monitoring the UV index, and seeking shade. Equitable and smart city designs, like 15-minute neighborhoods that protect against extreme heat, also protect against UV radiation. We can promote healthier lifestyles that reduce greenhouse gas emissions while protecting the health of Ottawa residents from climate health hazards. Thank you for your attention to addressing climate change and health impacts. OPH is one partner among many in this work, and we are dedicated to using the findings from the climate change and health vulnerability assessments to protect and promote the health of our community. Collaboration is crucial for effective climate change adaptation and mitigation. As one partner in this work, Ottawa Public Health will seek to contribute to and promote a coordinated approach across all sectors and levels of government. By working together and with targeted investments in this work, we can build a more resilient, healthy, and equitable future for all Ottawa residents. Thank you. Merci.
Thank you very much for the presentation. We don't have any delegations on this item, so we will go straight to questions. Member King.
Thank you, Chair, and thank you for the excellent report and really outlining the work that's being undertaken with partners. I know as part of your presentation, you focused on the idea of adaptation and preparing and responding and adjusting for the anticipated impacts. I'm interested in the work around extreme heat. And I was just wondering, based on the report itself, where you're talking about the public health unit working with partners to develop strategies, I'm just wondering what those relationships look like and what those strategies ultimately really turn out to be.
So there are multiple partners that we have within the city and in the community that we work with on extreme heat specifically. We do chair the city's extreme heat, cold and smog planning committee, where we work closely with our partners to coordinate activities related to extreme heat, which includes outreach to priority populations. We are also working on targeted outreach to people who are disproportionately impacted by heat. An example of that we have been working on recently includes outreach to older adults in lower income areas who live in high-rise buildings and may not have access to air conditioning to make sure that they have information and resources to help them prepare for extreme heat events.
I appreciate that work. I know that that there have been members of this board who have been working at other levels to ensure that we have inventories and information on access to air conditioning, especially for the older adults in our community. We know that there's a large emergence of naturally occurring retirement communities or NORCs where this is very important as a consideration. The other concern that I have is around ensuring that community centers throughout the city are prepared for heat events to ensure that residents, especially in high priority neighborhoods, have access to those community centers, and that those community centers are future-proofed in a sense with their technology. It's hard if we have a massive storm in the middle of summer, if there's no power, to have a cooling center. So one of the things that I would like to see, and I'm having discussions with staff on, is ensuring that there are technologies for all of our community centers to ensure auxiliary power, so that if power outages occur, that there can be auxiliary power sources that are attached to those buildings to ensure that services can be provided during emergencies. But these are the types of strategies that I think that we need to examine, and I'm really pleased that the public health unit is looking at them and across the whole scope of different scenarios, including wildfire smoke, which did affect the city over the last period of time. I think it's important for us to be prepared and to ensure that we continue to focus on this work. So I really want to commend the public health unit for doing that, and just encourage you to get into the weeds in terms of some of the strategies, that it's not just all high level, but ensuring that it addresses the challenges that many of our community members face. Thank you, Chair.
Thank you very much, Member King. Member Carr.
Thank you for the presentation. Yeah, support my colleagues' comments. I think we do need to do a lot more on maximum heat. And anyhow, I've got a couple other questions. My first question has to do with the vector-borne diseases, and I noticed there was a few new ones added. And I know in my ward there was a case of Powassan virus where the person just passed away tragically after a number of years with that. So my question is, how are we tracking these vector-borne diseases? I would imagine that there's internal tracking of these, but is there any external reporting at all on vector-borne diseases?
So we do monitor cases of vector-borne diseases in the community. We also work closely with partners to monitor the tick and mosquito populations within our community, and the presence of different pathogens within those populations. Information related to risk areas for ticks and Lyme disease in Ottawa is reported to Public Health Ontario and published on their website. And we also report cases of vector-borne diseases to the Ministry of Health.
Okay, but we don't have like a public facing external dashboard.
We do actually,
we do?
member Carr. It's new and it's every disease of concern for Ottawa Public Health, whether reportable diseases under the Health Protection Promotion Act. This is new on our website. It's gone published relatively unnoticed, but it's there for everybody to see. Whether you're talking about West Nile or Lyme or measles or HIV.
It is fairly new though?
Yes.
Okay.
Yes. And so we'll send out a link to everybody. One of the epidemiology team members is online. I don't know if you would like to speak a little bit more to that, Jacqueline Wilmore?
Hi, can you hear me? Fantastic, thank you. Yes, we're very excited to have launched the dashboard in, I believe it was the end of September, and it will be updated on a quarterly basis with data that I believe they're lagged about 2 quarters to allow time for the data to be finalized in our databases, and we do have comparisons there to the province. We look at rates over time and break it down by age group and sex, for example, so that if people are interested in a particular population, they're able to look at it that way. So I'd encourage people to explore it. It is interactive, and we hope that we've provided the necessary information there. And I should say, although the dashboard is new, reporting on these diseases on our website is not. We previously had some static tables that we would update on a quarterly basis there as well, but this is more interactive now.
Thank you. And keeping with the theme of reporting, do we report on illnesses because of extreme heat or deaths or any of that? Do we track that as well? And is that publicly available? And I just am missing everything.
I can start or Emily, I don't know if I mean, during extreme heat events, we do enhanced surveillance to look at the impact on emergency rooms, paramedic services, even social services, community center. Emily described have a network of partners that we ask to report in on what they're seeing. So that's during an extreme heat event. In terms of longer term surveillance of the impact of heat, that comes typically from special studies, and that's where we know that even though we may not have seen a massive event of 800 deaths like they saw in British Columbia when they had heat domes, we can predict that there will be increased mortality with increased heat. That link is well established, unless we have the right programs and supports in place. I don't know, Emily, if you want to add anything more.
We do work closely with our epidemiology team to monitor heat-related illness throughout the summer and throughout extreme heat events. And we use that information to inform the need for additional actions in collaboration with our city partners.
Okay, thank you. Can I ask 2 more quick questions? I promise they're quick. Obviously, reading this climate change report and listening to some of the discussions earlier where we speak about vulnerable people, something that strikes me is, we talk about the importance of DEET, we talk about the importance of sunscreen, both relatively expensive products for people. And I'm wondering if public health has any access to these products somehow that can help support people who are more vulnerable and may not even understand the importance of those products. It's kind of
That's definitely an area where we are working with partners to identify ways to address some of those barriers and to support access, particularly among people who might face additional barriers that preventing them from accessing those things.
okay, thanks. And then I think my last question is more of a comment, unless somebody wants to respond. I found it interesting, we talked about the different areas of climate change, vector-borne diseases, extreme heat. I did find it interesting that there was no mention of impacts of floods, and they are the most frequent natural disaster. We experience them a lot, and the impacts in terms of power outages that can happen as a result, but there's also specific health risks like standing water. If you have sewer discharge in your house, it can bring mold, respiratory effects. And I'm wondering if flooding is something that's been discussed at all, the impacts, public health with climate change. I might have missed it in the report. I missed everything else, so I don't know.
So with this report, we did focus on those health impacts related to climate change that are most likely to impact Ottawa residents. We do work closely with the city, including through a co-location with the Strategic Initiatives Department's Climate Resiliency a service area, which is looking at climate change more broadly in Ottawa. So we do work with them to make sure that there is a health lens to the work that they are doing to develop the city's climate resilience strategy.
Thank you very much.
At the risk of prolonging the conversation, there is interesting evidence emerging that people affected by a flood also can have longer term mental health impacts. And that we speak about the mental health challenges that are potentially there with climate change. And this is one of them. Certainly, I know members of our community who have experienced flooding. This would resonate that you worry about the next time.
Yeah, and that's something that we see all the time in those older areas where people are, every time it starts to rain, that they're very concerned, and it's, there's post-traumatic stress as well. So it is a significant area in all elements of health. Thank you very much.
Thank you, Member Carr. Member Kavanaugh?
Oh, just a quick comment. I think that yours is probably the scariest report there is, because it's going to affect us all, but the equity issue is important, and appreciate it, because some of us can get air conditioning, others can't. It's something I only got a few years ago. Didn't think I needed it in a house. But eventually you find out that you can't hide in the basement forever, that it's something that's necessary now. So I appreciate all the work on this, and the spectrum of concerns it is just mind-blowing, including ticks and other things that are perpetuated even worse by climate change. And I hope that those who are not concerned about climate change realize the impacts, and this report's very helpful to show it. Thank you.
Thank you, Member Kavanaugh. I'm not seeing any other questions, but yes, thank you very much for this report and for the presentation. I think these are risks and harms that we all hear about, and we know that they're out there, but to see them compiled together and to hear that these are really some of the top health risks facing people in Ottawa really sort of paints a stark picture of what we're up against. And I do think as a city, we are getting better at embedding public health and climate change lens into some of our major policies. I think about the official plan. You talked about co-location with strategic initiatives. I want to note that the Director of Climate Change and Resiliency is here with us tonight. So I think that collaboration is really important as we go forward. And so I just want to thank you for all your work. Thanks, everyone. Is this report received? Carried. My apologies. Is it carried? Carried. Thank you. Okay, on to the next held item, 7.5 risk management at Ottawa Public Health. We can start with you, Member Gower.
Thank you. A question and then a comment, I guess. The question, we're reporting 5 significant areas of risk to the Provincial Ministry of Health. Do they get back to us on those typically? Like what happens then after we submit those 5 areas of risk?
No.
So they don't look at, I'm going to be a bit flippant here. They don't look at worsening drug toxicity, housing, mental health crisis combined with an insufficient comprehensive multi-sectoral response leading to unsustainable demands. They get that report, but we don't directly hear back from them.
We don't hear back officially, but it's a bit of a snarky answer to say no.
Yeah.
Excuse me. Certainly, I know the Office of the Chief Medical Officer of Health receives this information. They look at it. It is behind some of their work, right? To review the standards, to look at what we're being asked to do, and also to take these needs to other parts of the ministry. So I know our Chief Medical Officer of Health connects with other parts of the Ministry of Health to point to the need for more mental health and addictions treatment. Some of these, I think our reporting up does inform, that kind of action at the province, though we don't always get a formal report back.
And yeah, I imagine, I would hope none of these are anywhere close to a surprise.
No, another example is the technological solutions. We know they're working on those, and so it's a bit of a reminder to them. We're still worried out here. We still need those tools, and I know they're moving forward solutions within government.
I wanted to raise it because in any boards that members are on, we get risk management reports, and often they're pretty boring, and often they have a lot of green, maybe a bit of yellow, and we receive them at our boards and we move on. And we were almost ready to do that today, because there are no surprises in this. We hear about this at every single meeting, but there are 5 significant areas of risk, many due to factors outside of our control, but they are around the most serious issues that are facing our city around mental health and substance abuse and housing, climate change. We just had a great discussion on complex community needs, which ties into the food insecurity that we saw today, and public health capacity. Like, these are all areas of bright, bold red on our risk report. And I think sometimes we're just tuning them out as board members, as counselors, because we hear it so often. And I think they've got to be top of mind. I know there's a funding review underway, funding formula from the province. This is important, and I hope we get some good news next year that the province will step up to meet some of these resource demands. I feel like last year our council was really focused on our housing budget. This year we're very focused on transit. If there's not a solution from the province, I think we have to have a really hard conversation around this table around our budget ask. Maybe it's in this year's budget. If we expect Ottawa Public Health to be ready to respond to day-to-day needs and emergencies, and the province year after year does not come through with the funding that they are supposed to, we either have to find another source of funding or be very upfront with the public. Here's what could happen. And I don't want to lose sight of that as we go into our budget process in the next few months. So thanks, Chair.
Thank you, Member Gower. Well said. Not seeing any other questions. Is this item received? Great, thank you. We'll move on to item 7.8, draft operating budget for the Ottawa Board of Health. So we will be passing out a package to members. And those who are joining online, you will get an email. So look for that.
Honorable Chair, board members, my dearest OPH team, and distinguished members of the community, Shubho Shondha, Oswa Masal Khair, good evening. I am honored to present Ottawa Public Health's 2025 draft operating budget tonight. I would like to start by highlighting the main focus of 2025 budget, and it is to maintain key priorities and services shaped by 3 strategic pillars. Number 1, Ontario Public Health Standards. Number 2, OPH strategy. And number 3, term of council priorities. What does it mean for us? It means we will continue to support programs aligned with these strategies that are proven to have a maximum impact on population health. In this slide, there are some examples of some of the high priority and impactful programs. With our priorities in place, let's now explore the budget pressures and broader context that have shaped our planning for 2025. The first step in preparing our budget was identifying key budget pressures. We estimate a compensation pressure of $2.56 million to maintain our current 511.11 FTE positions. This pressure is driven mainly by provision of cost of living and salary adjustments. It's important to note that OPH's FTE positions has only grown by 6.2 FTE over last 14 years. We have effectively managed non-compensation budget pressures by conducting a detailed line-by-line review of our 2024 non-compensation spending. This analysis allowed us to pinpoint opportunities for cost savings, including lowering expenses related to phone and air card uses, for example, reducing expenditures on professional services due to decreased demand, and additionally, we have reallocated funds from lower spending categories to alleviate pressures in high cost areas. Our commitment to enhancing cost efficiencies is supported by regular monitoring of our spending patterns. The OPH leadership team has also conducted a thorough assessment of budget pressures, not just to sustain core public health services, but also to explore growth opportunities to address emerging community needs. A detailed analysis is available in the report titled 2025 Budget Planning and Consideration for Ottawa Public Health, presented to the Board of Health in September 2024. Please be reminded that Ottawa Public Health considers 2025 a transitional year for several reasons. First, the Ministry of Health is expected to release revised Ontario public health standards in the coming weeks, and the impact of these updates on our budget is yet to be determined. Second, the ministry is conducting a public health funding formula review in which OPH actively participated and provided key feedback. In our written submission to the Ministry of Health, we have stressed the need to address our chronic underfunding, which has resulted from the inequitable application of fair funding model across public health units. OPH also called for annual increases to base funding that reflect population growth and inflationary pressures. The results of the funding formula review are anticipated in spring 2025, with implementation targeted for 2026. Therefore, OPH's 2025 budget addresses only the immediate pressures to sustain current services without including any growth opportunities that may be pursued in 2026. Assuming a fair application of the new funding formula by the province. Given these immediate pressures, let us highlight the specific budget directions that we have taken in consideration. We have prepared 2025 operating budget in alignment with provincial guidance on revenue growth and municipal budget direction for 2025. As a result, We anticipate a $395,000 revenue increase, reflecting a 1% rise in the Ministry of Health's 2025 base funding for cost-shared mandatory programs. We also expect a $226,000 revenue increase due to enhanced annual base funding for the Healthy Babies, Healthy Children program, effective April 2024. The Ministry of Children, Community and Social Services increased our base funding by $902,000 annually. Only 75% of this increase is reflected in our 2024 budget because the effective date was April 2024. The remaining 25% that represents this $226,000 will be incorporated in the 2025 budget. Thanks to our chair and also our board member for their continuous advocacy to increase this base funding. Lastly, we have included a $1.25 million increase in the net requirements funded by the City of Ottawa, aligned with the City Council's directive for a 2.9% increase in the municipal tax levy for public health funding, along with 1.5% increase in assessment growth taxation revenues generated from new properties. Now that we have established our budget directions, let's take a closer look at the projected operating expense for 2025. For 2025, our total net expenditure is projected at $82.7 million. This represents a $1.6 million decrease from the 2024 operating expense. The reduction is largely due to removal of additional one-time provincial funding received in 2024, the amount of which exceeds the cost of living adjustment driving up the 2025 compensation budget. We anticipate some of these additional one-time fundings for seasonal respiratory illness, immunization, and outbreak response will continue in 2025. However, they are not included in the current budget as we plan to adjust the budget once formal confirmation is received. Moreover, we have taken steps to ensure that the absence of some of the additional one-time funding will not disrupt the continuity of our programs. For instance, given the high impact observed since its launching, we have integrated the cost of neighborhood health and wellness hubs into our core base-funded programs. As you notice in this slide, we are providing a breakdown of our expenses across 5 program categories. The cost share programs is the largest one. The expense is estimated at $70.8 million. And these programs are funded jointly by the Ministry of Health and the City of Ottawa. The next is our Healthy Babies, Healthy Children program. The estimated expense of delivering this program is $5.5 million. This program is fully funded by the Ministry of Children, Community and Social Services. The next is Ontario Senior Dental Care Program. The estimated expense of this program is $3.3 million. This program is fully funded by the Ministry of Health. We have some programs fully funded by the City of Ottawa, and these programs include dental care, mental health, head injury, and school outreach programs. The estimated expense of these programs is $2.7 million. Lastly, the miscellaneous categories include Indigenous public health and HIV/AIDS programs. They are fully funded by the Ministry of Health. The estimated expense is $482,000. Now that we have examined our expenses, let's move on to the revenue estimate that will support this budget. Our total revenue estimates for 2025 is projected at $51.9 million. We are also providing a big breakdown of our revenues according to their sources. Our primary revenue source is the Ministry of Health, from which we expect to receive $44.5 million. Additionally, we anticipate $5.5 million from the Ministry of Children, Community and Social Services. Cost recoveries, such as physician consultation fees, dental procedure fees, and reimbursement for vaccine administration services are projected to generate approximately $1.2 million. The City of Ottawa is providing OPH a one-time stabilization funding of $450,000 to address exceptional budget pressures. Thanks to our chair for advocating for that. We are also drawing $275,000 from our IT reserve to support technology costs. With our revenue estimates established, let's review how we are actually achieving a balanced budget for 2025. We estimate our net requirement by subtracting our revenue estimates from net expenditures. It is currently $30.8 million and will be fully funded by the City of Ottawa. The 2025 net requirement is $1.25 million higher than 2024. And this is reflecting a 4.2% increase in city funding. So for 2025, OPH is presenting a balanced operating budget of $82.7 million, supporting 511.11 full-time equivalent position. Let's take a look at the next steps in the budget approval process and timeline. This slide highlights the next steps and budget approval timelines. After tonight's meeting, the BOH budget will be tabled with City Council on November 13 and then returned to the board on December 2nd for public delegation and approval. There will be opportunities for public feedback throughout the month of November, with further discussion at the next BOH meeting on December 2nd. As we conclude our overview of our expenses, revenues, and process of achieving the balanced budget for 2025, let's take a moment to highlight the key takeaways from this budget process. I like to highlight 4 key takeaways from here. The first, OPH is proud to present a balanced budget of $82.7 million. And this has been achieved by optimizing funding allocations, focusing on high priority programs to ensure the most effective use of our resources. Second, despite facing budget pressures and lack of additional one-time funding, OPH has successfully safeguarded the continuation of key programs. We have embedded the cost of our neighborhood health and wellness hubs into our core base-funded programs. This integration is crucial due to the significant impact these hubs have on community health and well-being. Our commitment and efforts ensure that essential services remain available to our community. Third, please remember that our growth pressures remain, even with a balanced budget. To strategically position OPH programs for growth, we have identified key budget pressures resulting from the increasing demand for public health services. We are actively working with the province, awaiting the outcomes of the funding formula review, and investing time to secure additional funding from diverse sources. Finally,
I have to interrupt you quickly because we need a motion to go past 7 p.m. So we're just going to go to Member Kavanaugh really quickly and then back to you, Kibria. Sorry.
Okay. Thank you, and apologies for interrupting. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Thank you, everyone. Go ahead, Kibria. Sorry about that.
Thank you so much. Finally, OPH considers 2025 as a transitional year when we focus on sustaining the programs that are vital to our community's health, while we actively work on long-term planning initiatives to ensure financial stability. In summary, OPH's balanced budget reflects our commitment to prioritizing essential programs, ensuring continuity, and strategically positioning ourselves for future challenges. I'm very grateful to Team OPH, including our senior leadership team members, managers, supervisors, and staff members for their guidance, support, and timely response to queries over the last few months. I want to express my deepest appreciation to our board members for their guidance and support throughout the budget preparation phase. I had the pleasure of collaborating with our colleagues at FSU, and I thank you for your support. I want to thank our provincial funders, Ministry of Health and Ministry of Children, Community and Social Services for their timely guidance and support too. And lastly, I'm very, very thankful to our residents for their continued engagement and support and their confidence on the work that we do every day. We welcome any questions at this time, or the board members also can send out their inquiries to Casey. And the residents can also comment on the draft budget via the email at healthbudget@ottawa.ca. Maxi, Migwage, Shukran. Thank you.
Thank you, Kibria. Insightful as always. We will go questions. Anybody has any? Vice Chair.
Thank you for this. It is no mean feat to present a balanced budget within the direction from the council, so I appreciate this. Two questions for, and I guess I want to thank staff at OPH as well. I think you were a department that was leading edge in terms of doing that line by line review and making sure that the investments were solid in the key priorities of the board that's been set forth. So I think that really puts us in good stead to be having this conversation. So thank you. I did want to call it just to make sure that I understood it correctly. So we're using 725,000 essentially of reserve funds as one-time funding to balance the budget this year. Have I understood that correctly?
That is correct.
Okay, so that'll be part of our, when we say about budget stabilization, as this being a transition year, that's one way that we've been able to present a balanced budget. So I think that's worthwhile sort of flagging, is that that's one-time funds, and really the impetus is on us to make sure that we have a plan going forward. The other piece at the provincial level, the talk has really been around the proportion of provincial versus municipal funding for public health in this new model, and we'll wait to see what the province presents in terms of their funding model. But with this budget, do we have a sense, or have it been calculated yet, about what this proportion would be? Is it 70-30, 65-45, or what is that proportion at this point?
Thank you for the question. Currently, the proportion sits around 60-40, I would say. So that has to go to 75-25 after the funding formula review.
So, and I didn't mean to spring that question on you. So if you need to get back, but what's the trending over time? Has it, so if we're at approximately 60-40 now, has that decreased over time, the provincial share?
It has decreased over time, unfortunately.
Yeah, so that'll be a key piece for us to be advocating for in terms of as we look across the province about what that share would be and how we can make sure that the region is reimbursed an equitable amount. So thank you.
Thank you, Vice Chair. Member Kavanaugh.
Thank you very much. This is a tough task, no doubt. It looks like the way the province is going is that they're picking programs to fund rather than the overall funding, where we only got 1% increase. So such as the healthy babies, et cetera. But one of the concerns that has been raised, and I and I'm looking quickly to see it, is about wastewater monitoring, which we had funded before. So, and of course, that was pushed back on, but is there any update on that and where does it fit in?
Thank you for the question. We worked with our other partners, CHIO and University of Ottawa, and we have signed an agreement with the University of Ottawa for next 1 year to support the wastewater program jointly by OPH and also CHIO funding. We ensured that the next 1 year the program is funded.
Thank you very much. I appreciate it. I think it was very valuable to OPH, and I think it was very short-sighted to lose that funding by the province, as in many programs that I could name, but I'll just stick to that for now. But I think we're doing excellent work considering the circumstances, and interesting that you call this sort of transitional. So, because we don't know what the future holds, so we'll see. And I just continue to hope that Ottawa Public Health and other health agencies are recognized for their value. Thank you.
Thank you, Member Kavanaugh. I'm not seeing any other hands, so I know I say this every time you're in front of us, Kibria, but just want to thank you again for your incredible work to put forward a balanced budget. I know it's not easy, and certainly as chair, I commit to the board and to the organization and to the residents of Ottawa. I will continue my advocacy, our advocacy to the province with respect to the funding formula review, but really taking any opportunity to advance our priorities. We've been talking a lot at the city about fairness for Ottawa, and this is unfortunately another example where we are underfunded per capita. So lots of more advocacy to come in 2025, but thank you for your work and for going above and beyond to ensure that we understand the budget and the implications going forward. So with that, is this report carried? Great. Thank you, everyone. Motion to adopt reports. Member Kavanaugh.
Be it resolved that the chair, the Board of Health verbal report, the medical officer of health verbal report, the reports titled 2024 Nutritious Food Basket and Food Security, Climate Change and Healthy Vulnerability Assessments, Risk Management at Ottawa Public Health, attendance at the Association of Local Public Health Agencies, ALPHA, Fall Symposium, and delegation of authority contracts awarded for the period of January 1st to June 30th, 2024 be received and adopted. And be it further resolved that the report titled 2025 Drafting Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of the 2nd of December, 2024.
Thank you. Is the motion carried? Great. Thanks, everyone. I don't believe we have any motions requiring suspension of the rules. Do we have any notices of motion? Seeing none, confirmation bylaw.
Okay. Be resolved that the confirmation bylaw number 2024-4, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 4th, 2024 be read and passed.
Is this carried?
Carried.
Thank you. Do we have any inquiries this evening? Seeing none, the meeting is adjourned. Our next meeting is Monday, December 2nd. Thank you, everyone. Lots of great conversations this evening. We'll see you next time.